So, how much is something like that cost to place an implant? Is that pretty affordable, or is that something that's very expensive?
Great question. It depends on the budget. I get this question asked a lot. Depends on the budget for everybody, credit score, but it could be as low as $105 a month.
Nice, that's awesome. So that's pretty much like a couple coffees a week, huh?
Pretty much, yeah. Welcome to another podcast here at West Chase Miles Institute. I'm Dr. C.
It's Nathan, the hygienist.
Yanni, the treatment coordinator.
Excellent. So guys, welcome back. Today we're going to be talking about implants, okay? A little bit more information on how implants work, what are we using for, the maintenance of the implants, and how affordable implants are. So throughout the podcast, if you have any questions about anything that we discussed today, please write your question below or comment, and then we can answer those for you in the next podcast or through messenger back. Go ahead, let's get started. Implants. What are implants? Well, we use implants to replace a missing tooth. Okay, that's the basics of an implant placement. Now, we can also use implants for a lot of other things, like replacing a full arch restoration. What does that mean? It means some people are missing a lot of teeth in their mouth, right? When they're missing a lot of teeth, 1-2 implants will not work. We need a bunch of implants to support a full arch, something that kind of looks like this. Good. And then these are snap-on implants, and we'll get into more details on what they are as well. But this will snap right on, and this will restore the full upper arch of a patient. Nice. So let's go back to basics, right? Are every patient a candidate for an implant placement?
No.
No.
Who is a candidate?
Good. So a candidate for an implant placement, pretty much they have to have a nice solid bone. Okay, we need to have the nice width of a bone, and we need to have a nice height of a bone. Why? Because we need to place the bone within the distance so they can integrate with the bone, and then we can use it as a fake or as a prosthetic root to place an implant on top. It will look something like this.
Doctor, how do we determine who has the bone for implants?
Good, that's a good point. Yeah, we take like a 3D image for the patient. They come in, we'll look in the mouth, we'll take a 3D image and see in a 3D dimension how the bone levels look in every single aspect of the way. As well, we need to plan it as well to make sure it matches with the upper bite as well on the patient's mouth. But yeah, that's a good point. Good question. So an implant has 3 parts to an implant. The first thing that we do is place that implant into the jaw line. Some of the questions that people ask about implant placements, are they painful? Thank you. Are they painful? Really, placing an implant is easier than taking a tooth out. Why? Because we plan it ahead of time before the patient even gets in the chair how the implant is going to go into the mouth and how it's going to be restored. In comparison to when we do an extraction. When we do an extraction over the mouth, we don't know how the tooth is going to respond. A tooth can break. If it's a tooth with a root canal treatment on, it will definitely be into pieces. And if it's already a broken tooth, most likely when we grab the tooth, it's going to shatter into more pieces. So really placing an implant is a lot more predictable than taking a tooth out from the mouth. So let's go talk about the 3 parts of an implant, right? The first thing is the implant that goes into the jawline. Okay, the post, correct. So that heals for 3 to 4 months. Okay, after the 3 to 4 months, you come back, we'll take a look, everything looks great, awesome. Next step, we'll put something that we call an abutment on it. The abutment goes inside that implant. That screws into that implant itself. Right.
So if the post is in for a couple months, how do you check to see if it's actually healed up?
Good. So we check with an X-ray as well. We'll take a look at the X-ray, make sure everything is integrated, it looks nice and solid all around, and then it's good to go. Okay. Implant success rate is about 98% of the time, so they heal very well. Studies have been done since 1980s that we've been placing implants, and they've been working just fine. Now, that's the second step. The third step will be the final crown. After you place the implant, you have the abutment. Then we'll take an impression and we'll send it to our lab to fabricate the final crown, and that's how it sits right here.
So what would you say the total time, as far as from beginning to finish, before they could actually have a crown on the tooth?
Yes, if everything goes well, 8 to 10 months, and they'll have a tooth in the mouth.
And what determines the success rate for a patient?
That's a good point. Systemic problems like diabetes, are they smokers, are they chronic drinkers? Hygiene, definitely hygiene, because if they have some gum problems, definitely that will compromise that implant. Not that it won't take, they will compromise it. So we have to make sure that patients are on a nice recall or a nice coming back every 3 to 4 months to make sure everything's looking good and everything is healthy. Yeah, good questions. One of the questions that we get often asked is, am I gonna be missing the space there or missing the tooth there for a little while? If it's a back tooth, we have many options. We can put something that comes on and off to replace that empty space and keep the space. If it's a front tooth, sometimes if everything looks great, we can replace the tooth the same day with that implant that we'll place in the mouth. So it all depends on where the tooth is missing, but you will go home with something in the space, so that way for cosmetic purposes, you have something there to smile or to function as well. Good?
What about if you have more than one tooth missing in the same area?
Yeah, that's a good point. So we do what we call like a bridge. Okay, so we place 2 implants, one on the front, one on the back, and then we'll place the abutments, and then we'll connect the whole arch together to replace a whole area of the mouth. Like I said, the right side is missing, we'll replace the whole right side with only 2 implants. We can replace up to six teeth with just 2 implants at a time. Yeah, depending on bone levels. Yeah, looks good. Yeah. And obviously maintenance, right? Comes with maintenance. You have to come in every 3 to 4 months, right? That's when Nathan comes in. He checks on everything, make sure everything looks good. If we find a problem, it's easier to fix when it's actually, the problem is starting than when you come in 2 years later and something else more is advanced to the problem.
Exactly. So what if they come in with the whole mouth, like a snap-on denture? What is the maintenance process on that?
Yeah, so snap-on dentures is something that, snap-on dentures, right? Snap-on is something that actually patients can snap into their mouth. So we'll place the implants, we'll place the abutments, which are like this, different components from a single crown, and then we'll have little rings that go inside the denture itself. These rings will snap into the jawline, just like this, right? And it will stay stable. It won't come out. It will stay in place. You can function. You can function very well, and cosmetically, it will look very pleasing as well. Now, the difference between something like this is that you do have to replace the rings that are inside. Why? Because they are plastic. They will wear. You have to take this out every night. So by taking them out and putting them in, this will get loose and not as stable. So you'll come into the office, we'll replace the rings, and then you go home with stable implants as well. But the maintenance on the implants also need to happen. So you come in, we'll clean those implants to make sure the implants are looking good and they're healthy.
We come in about every 8 months to clean those, correct?
Correct. For the snap-ons, about 8 months, yeah.
And what patients are candidates for this type of treatment?
That's a good question. I mean, it all depends on budgeting, really, because patients that can't afford to place 4 implants on the lower jaw most likely can have something that's fixed in the mouth, okay? But it all depends on what the patients can afford.
What's the difference between a snap-on denture and something that is completely permanent, like a hybrid or an all-on-4?
Yeah, that's a good point. One of the main things is actually the material. The materials that we use for something hybrid, which is something like this, compared to something that snaps on, is the material. The material on something like this is more cosmetic, it's more reinforced, and you don't have to take this out of your mouth at all. You'll have something in the mouth that will stay there, you'll function very well, and we'll take it out for you to kind of clean them when you come into the office once a year.
Yeah, so you'll come in once a year for those cleanings, correct?
That's correct, yes. Yeah.
How are they cleaned at home?
Good, with the water pick. The water pick will go, we'll give you a water pick for your treatment. So, like, guys, if you have a question about specific things, remember, write your question below and we'll answer those for you, okay? So, water pick. Water pick will go right underneath between the connection of the hybrid, which is something like this.
The water pick is just basically pressure water spinning under there, going underneath the gums. Correct?
Pretty much, you just spray the water underneath it from the front and the back, and that's it. That's pretty much the maintenance of something like this.
What's the lifespan on something like that?
Good. So if you keep coming once a year, most likely you can keep it for a lifetime. Yeah, lifetime is that's what we're looking forward for you to get, a lifetime, a prosthetic that will last you for many years without any problems. And that's where the checkups come in. If we find something going on, we're going to address it right away. Some of the questions that people ask is also, do I brush them, right? Yeah, you do have to clean them, right? You clean them very gentle.
Just to take
off take off the food that sits on the teeth themselves. That's for a hybrid. That's for a denture, for a snap-on denture, you have to take them out every night, okay? These have to come off. And you put them in a little box, you put your water, you put your little pill that will clean them, and then you take them out in the mornings and snap them into your mouth as well. Yeah,
it's probably a good idea to still brush the posts that are inside too as
well. And that's where the water pick comes in as well. Yeah, if you do have something that removes like this, you have to clean the posts on a daily basis. You can brush them a little bit if you want, but the water pick will be the main tool that you'll be using to clean this implant. Yeah, good question, guys. Very nice.
So, how much is something like that cost to place an implant? Is that pretty affordable, or is that something that's very expensive?
Great question. It depends on the budget. I get this question asked a lot. Depends on the budget for everybody, credit score, but it could be as low as $105 a month.
Nice, that's awesome. So that's pretty much like a couple coffees a week, huh?
Pretty much, yeah. If you're going through something like this, please write your question below, or come to the office and we'll take a look and see what you actually can get done. And we'll help you all the way throughout. We'll ask you some questions, we'll take the pictures, we'll do everything that we can on our side to make sure you get quality work, okay? So some of the difference, okay, with the regular prosthetics compared to something that snaps on, right? Why do we want implants? One, because they're gonna be steady, they're gonna anchor into the mouth. What happens when you don't have implants in the mouth, right? Well, one, the bone levels are going to continue to go away because they're not stimulated by anything to stay in that place. So they continue to go. So that's where you need to come in and take a look if you are a candidate for an implant placement, okay? So if I don't have implants, right? If I don't have anything, it's like putting this on a piece of paper. It will slide everywhere. And with the movement of the tongue, the cheeks, it will pop right out. That's when you see the funny videos on the YouTube channel, right? The TikToks, the grandpas.
Blowing the cake.
Pretty much, and it goes everywhere.
Teeth come out.
Right, you want to avoid those things because eventually, one is function, right, the main thing, but the other thing is you don't want to be embarrassed in front of a lot of people, popping those things right out. And that's what implants are good for, to anchor things inside. The more implants we can place, the more anchors you will get. Okay, we can get as low as 2 implants in the front to anchor something. We've done cases that I only place 1 implant because of the bone levels, but it works way better than having nothing in the mouth.
So what happens if the patient just recently went into maybe say another office or maybe a year or two ago and got a full mouth denture, but they're not happy with it because it's not holding in? Are they maybe a candidate where you can do something with that denture as well?
Yeah, like we mentioned, the best thing is come in, guys. I mean, we'll take a look and then we'll take it from there. But yeah, patients that just had the extractions done are better candidates than somebody who's missing the teeth for maybe 20, 30 years.
And you mentioned bone loss.
Yeah.
What causes bone loss?
Good, the non-stimulation of the bone itself. So when you have teeth in the mouth, the bone will stay in place. You have nice dense bone, you have stuff that stimulates the area to kind of be there.
Blood flow from the teeth.
Exactly, the teeth have ligaments, teeth are alive, so they make sure the bone stays in place. When there's nothing there, there's nothing to stimulate the bone to stay there, so it will remodel to pretty much nothing. So that's when you see like the jaw going all the way up into the mouth, very flat, and that's where dentures come in. That's where implants come in to make sure we restore the bite again, to open up again, so they can have a nice smile and function.
Can somebody that's had dentures for 20 years, 10, 15 years, still be a candidate for implants?
Definitely, yes. If you have just the main thing, like again, come in. We'll take a look. That's what we want you to come in for, to evaluate and see if you are a candidate. We have to take a CT scan or a 3D image to make sure we can see how that. But most of the time, yes, we can place some implants in there.
For implant, what is the healing period for, let's say, a hybrid denture that's completely permanent? What's the healing period, and what's the full time frame from beginning to end for something like that?
Yeah, for a hybrid, we need a month to plan your whole case. Once you come in, we'll evaluate, we'll plan everything, we'll set your date out for a month later for surgery. That day, you'll come in. If you have teeth, we'll take all the teeth out and we'll place your hybrid right away. So you'll go home with something to function the same day. We have to wait 4 months for the implants to heal, 4 to 6 months. When you come back at 4 months, everything looks good, great. Now we'll start working towards the final set. If you like what you have in the mouth, we'll duplicate what you have on the final, materials that we're gonna be using, which is gonna be zirconia. If you want to make some changes, then we'll go through the changes that you want. Make sure you want them a little wider, you want them a little longer, whatever needs to happen, we'll make sure you like everything before we process everything towards the end. So for 6 months from beginning to end.
What are implants made of?
Titanium. Implants are made of titanium. You have some zirconia implants as well. Titanium is the ones that are most studied, and that's the ones that we use for full restoration in the mouth. People ask often how painful they are. Okay, you'll be surprised. They're not painful. Okay, patients have to come back 24 hours after surgery for us to check how they're healing, and we're surprised that they have no pain. They'll discomfort, but no pain. Yeah, and they can actually start using it. They speak very well, and everything stays in the mouth.
Do they have to be awake for the surgery?
Most of the surgeries, we keep our patients awake. Okay, they are sedated. Okay, so they don't remember much of the surgery, but they are awake so we can see how everything functions, how they're talking before they leave the office, yeah. Some of the difference between the upper teeth. On the upper area, on the bottom ones, we know already that they will pop out, right? They won't hold in place. Nothing will stay in place because it won't suction into anything. They'll just move, they'll come right out.
Without implants.
Without implants, correct. With implants, they will anchor in. The more implants we have, the better anchorage. On the top is a whole different world. Why? Because the teeth on the top will suction into the palate and then will stay in there.
Exactly, because
right?
you can put that plate on the top.
That's correct. So it will cover the whole plate. So what changes there? Your food, your eating, your habits will change. Your speaking will change. Why? Because now your denture, it's invading the space that your tongue is used to freely move before. Now it has something there. Now you have to learn. And some people can't even take it because they'll have a gag reflex that will start acting on it, and they can't even wear it. That's where implants come in for the top. Why? Because, again,
it's a lot thinner as well.
Exactly, and it's a horseshoe shape. Okay, it will sit just in the gums and will snap right up in there, just like that. Okay, that's for something that comes on and off. For something that stays in the mouth, it will look something a little bit more like this, right into the gum line, more fitted, screwed into the mouth. You don't have to take them out every night. So, more function, cosmetically.
Permanent solution.
Permanent solution is always the best way to go.
For cosmetic purpose, is that pink part, the connector, are people able to notice that, able to see that in the mouth?
No, we'll hide that stuff for you. I mean, you will have to have it there to kind of connect and make it intimate to the gum line, but it will hide it. Some people don't show that part, so we'll make sure everything is nice and it cosmetically looks really.
And it will be custom, obviously, to the color of your tissue, existing tissue, so that way it's more.
It blends in.
Blends, so when you open your mouth, you don't really see the change in color because it's really the same color as your.
As she comes. Exactly, and that's where the beauty of design in this case is coming. Okay, we'll take a look at all these details, we'll talk to you, so we'll sit down and discuss all this with you when you come in for your consult as well.
You can actually have it designed too as well, so that way they can actually see maybe what it would look something like as well.
Definitely, and if you have pictures from before, like let's say I had a beautiful smile, things happen, things change. Now when the smile back, great, bring us the picture so we can take a look. And then we'll talk to our lab, we'll talk to our designer so that way we can make sure it matches as close as what you want. Some people do have their diastema, what we call the spacing between the front two teeth, and they want to keep the space, right? It's cosmetic for them, it's tradition for them, so we do keep the space in the middle because that's what they're asking for. So everything is based on what the patient needs and wants pretty much. But our main reason is to give you guys function back. Why? Because if you start eating or swallowing foods in big chunks, your stomach will work in ways, it has to work extra hard to break things away. So what happens, your nutrition is not good. So your stomach has to work extra hard and eventually things will follow from there.
So how common are implants? I know we've talked a lot about, why you would need them, the cost. How is that something that's very common now that people are putting implants in, or is that...
Yes, we do it here on a daily basis. In cases like this, definitely, because people are missing too many teeth in their mouth. And we know by research the more teeth you're missing, the less lifespan you will have. So people are getting to know more of this stuff, which is good. Education is number one key, guys. So it's very common, to answer your question. It's very common, we do it often. People come in, we find solutions for them. And it's targeted to specific people, right? We have different things when you come in, we'll make sure it fits your needs. That's what I'm trying to say. It fits your needs and it fits what you want to bring back your function, your cosmetic purposes, and to be comfortable.
So they basically design a plan exactly for you then, basically.
Exactly, yes. And like I mentioned in the beginning of the podcast, everything is planned. Everything is 3D planned before you even get in here for day of surgery. So we know exactly how we're going to go in there, how we're going to place those implants, how they're going to go, how we're going to fit your upper teeth to your lower teeth. Everything is already pretty much ready to go.
All right, so we went over a lot of information and we gave you pricing, longevity of the implants, easy. How would they actually find our office? How do they find our office here?
How do they find
That's a good question. You can look us up online. We're in Google. You can type down your questions below, any specific questions that you have, and we can reach out to you directly. Or you can call our office. Our phone number is 813-920-9144.
They can even text too, right?
Yep, they can text that same number or go on our website, westchasemilesinstitute.com.
Yeah, make sure you follow us on Instagram and TikTok, guys. We do have a lot of stuff going on in there. We have all the podcasts, YouTube as well. Make sure you click your link to subscribe. And if you have any questions or any specific topics that you want us to discuss or talk about, please write it below and we'll answer those for you. Thank you for joining us today. We'll see you guys soon.